Good evening, everyone. This is Ralph Marucci with Empire Surgical, here to discuss with you Knee Anatomy 101. I'm going to be breaking it down for you into anatomical motions. I'm going to break it down into bones, ligaments, cartilage, and muscles. First, the movements. The knee is capable of 4 major movements that we want to be familiar with. The first one is flexion. Flexion is when the knee extends backwards behind the 90-degree angle, using mainly the hamstrings that enable it to do that. Then we have extension, which is when the knee extends forward past that 90-degree mark using the quadricep muscles. And we have adduction, when the knee moves medially, abduction, legs moving away or more laterally. There are 4 major bones we'd also like to discuss. We have the femur bone, which is the long bone. I hope you can see that. Connects all the way from the hip muscle, bone down to your knee, central portion of your knee. That is considered the long bone or the thigh bone. Then we have the patellar, which is covering the bone. It's a very important cap on top. We have the tibia, which is the shin bone. It's also a very long bone. Connects right here from the central portion of the knee, right on down towards your ankle. And then there's a 4th bone, which actually isn't a part of the knee hinge joint. It's known as the fibula. It is a smaller portion next to the tibia, and it actually is slightly lateral to that. So those are our 4 major bones. Now, we know each bone, to connect bone to bone, we need ligaments. The knee has 4 major ones that I'd like to just discuss with you in this video. We have the ACL, PCL, MCL, and LCL. They are also broken down to 2 subcategories. The ACL and the PCL, we'll discuss those first. ACL, anterior cruciate ligament. PCL, posterior cruciate ligament. Cruciate is a term that refers to a cross, which is exactly the formation that these 2 ligaments create. They are right between the femur bone and they connect the femur bone to the tibia bone. Now the ACL will connect anterior on the tibial side to the posterior femur side, and the posterior cruciate ligament will do the opposite of that. It will connect from the posterior, the posterior tibial side to the anterior femur side, creating that cross. Then we have the medial collateral ligament and the lateral collateral ligament, which are on the outer portions of the knee, still connecting. The MCL will connect the fibula to the femur, and the LCL will connect the tibia to the femur. Both of them are very responsible for stability. We're preventing the knee from going into varus state, which would mean that the legs become bowed, or varus state, which would mean that they become more knuckled or boned, pushing together. We want to avoid those motions, so the stability in those 2 ligaments are crucial. Moving on, we have the cartilage portion of the knee, and that's extremely important for movement. There's articular cartilage, and then there's the meniscus. Now, the articular cartilage we'll find at the bottom of the femur, for example, also the top of the tibia. At the bottom of the femur, I also want to mention that there are also some more bony figures which have this articular cartilage at the bottom of them. They're known as the medial and lateral condyles, and they rest inside the medial and lateral tibial compartments. And again, these bony small aspects on the bottom and tops of those 2 bones have the articular cartilage that we are referring to help create a sort of barrier where it enables that motion that we're talking about. It's also very important to note that the knee needs synovial fluid, which is a way or a form of viscosity for the knee joint. We're allowing now for sort of like what takes place in a car When you have that engine oil put in there, it allows for the turbines to not crash into each other, and allows for that movement, that fluid movement. Okay. So back on track to the cartilage portion, we also have the meniscus. The meniscus is a very important piece of cartilage. It's sometimes found to have a small tear, in which we will need to repair that first before we can repair anything else inside. This is also another form of cartilage to take note of. Moving right along, we have the muscles of the leg. We have the quadricep, which is the very largest muscle in the leg. We have the hamstring, which is the posterior side of the quadricep, and is also very important. Also, in a lot of surgeries where you find an ACL repair, for example, we will take either an allograft or an autograft. In an autograft, we would be taking perhaps a small portion of the hamstring normally, either the gracilis being a more important tendon to shoot for, and then we have the quadricep muscle, which, as we all know from our studies of NEHAB, the VMO muscle or the vastus muscle will be one of the more important portions of the quad to discuss. So today in this brief video, we actually mentioned the bones, the ligaments, the muscles, and cartilage of the knee. I hope you enjoyed this video. If you have any questions, please do not hesitate to ask me. I appreciate you taking the time. Thank you very much.